welcome to Youth Diary. Today we have with us Dr. Vinod Padmanabhan from Sudheendra Hospital, Ernakulam. He is an orthopedic surgeon, specializes in arthritis and post-injury treatment. Welcome, doctor.
Hi.
Doctor, what are the common orthopedic problems that our community faces these days?
Nowadays, there are a lot of orthopedic problems affecting the population. The common ones are arthritis, spine-related problems, and then the trauma which leads to injuries, and a lot of sports injuries is also happening nowadays. As the population is getting more and more older, we have a lot of elderly people in our population. So the geriatric problems, that means the problems which affect the elderly people are also on the rise nowadays.
Doctor, we have a query.
Hi, I'm Niranjana from STT-SVN. I have a doubt. What is arthritis and how many types are there?
The word arthritis comes from Greece. Arthritis is, arthro means joint and itis means inflammation. These two words. So it's the inflammation of joint is called arthritis. Now arthritis is a broad spectrum. It ranges from wear and tear of the joints up to inflammatory type of arthritis. But it's usually characterized by pain and swelling and difficulty in walking and difficulty in moving the joints with restriction of movements of the joint. There are many types of arthritis are there. The most common one is osteoarthritis. Osteoarthritis means it's a degenerative joint disorder in which there is wear and tear of the joint. As age progresses, slowly there is wear and tear of the cartilage. Cartilage is the layer between the joints, which helps in giving the cushioning effect to the joint. And with age, as the age advances, arthritis also progresses. Now, apart from age, increased body weight, previous injuries to the joint, or some previous infections, they can all lead to the degenerative disorders, or what we call as osteoarthritis. Apart from osteoarthritis, then there is a group of arthritis called inflammatory arthritis. Inflammatory arthritis includes most commonly rheumatoid arthritis or the ankylosing spondylitis, many types of seronegative arthritis. That means it's all involves the autoimmune kind of disorders. But mainly, broadly, arthritis can be divided as osteoarthritis as well as rheumatoid arthritis. Now, rheumatoid arthritis usually affects little younger individuals. It's little more severe kind of arthritis. Usually affects ladies more than male patients, and it can come as even children can also get affected with. It's called juvenile rheumatoid arthritis. But usually the age group which is more affected is say between 30 to 50 years of age, and it's usually characterized by pain and swelling. It's usually affect the smaller joints of the body, not the large joint. Larger joints can also get affected, but at a later stage. Usually it involves morning stiffness. That means the joints, when the patient gets up in the morning, they feel that all the joints are stiff and there is difficulty in moving the joints. Apart from rheumatoid arthritis, there's still more severe type of arthritis which affect the spine as well as the other joints of the body, which include, that's called ankylosing spondylitis and different types. Treatment of arthritis depends on the stage of the disease. Now, usually the osteoarthritis, it goes through 4 stages. The early stage, in which there is just pain and slight swelling of the joint with mild restriction of activities. But as arthritis progresses, it goes into stage 2, stage 3, where the swelling and pain increases in the joint, and the patient feels more and more difficulty in walking. And apart from the joints, or whichever joint is affected, suppose the shoulder joint, they feel that their activities of daily living are affected. So initial stages of the arthritis can be treated by, say, pain medication, physiotherapy, lifestyle modification. I think that's very, very important. Lifestyle modification includes weight reduction, regular exercises, and that all helps in preventing extra loading of the joint, and that way it prevents arthritis. So this is regarding the treatment of arthritis.
So doctor, is there any need for surgery in advanced arthritis?
Definitely. When arthritis crosses a stage, when it crosses stage 3 and reaches stage 4, that means the advanced arthritis stage, definitely then the only treatment option is surgery. Now surgery depends on which stage, suppose early stages, that means around stage 3 where the joint is not completely damaged, you can still do some correction of the alignment. Suppose there is a deformity of the joint, you can do the deformity correction and still the joint can be salvaged. But once it reaches a stage when the complete joint is damaged, then the only option available is what we call as joint replacement surgery, also called as arthroplasty. It's usually done for knees, hips, and even for shoulders also.
Doctor, we have another query.
Hi, I'm Nazir. I'm a student of SGTSV in Uchum. And I want to know what are the common type of injuries you come across in the hospital.
Now many variety of injuries which come to the hospital, but the most common type of cause of injury which comes to the hospital is road traffic accident, which still is quite common in India. Though in the western population road traffic accidents are coming down, but in India still road traffic accident is one of the reason for major morbidity, and it's a major killer also, especially in the younger age group. Type of injuries because of road traffic accident, it can be as simple as a small wounds, and it can even lead to some big injuries like spine trauma, spine injuries, or the head injuries, all what we call as polytrauma. Apart from road traffic accidents, the other types of injuries which we come across are sports injuries, which is again on the rise. A lot of people are taking to sports. Then comes the old age injuries, also called as the geriatric population. They have what we call as the osteoporotic fractures, and also the household injuries, the common household injuries, which it varies from, say, a simple injury to the toe, sometimes a slip and fall in the house, which can lead to even sprains and strains of the joint. So different type of injuries we come across in our casualty.
Doctor, we have another question.
Hi, I am Sinsa from Saraswati Vidyanidiketan Uchma. I have a doubt. What is sports injury? How common are sports injuries? What type of injuries occur in sports? How are sports injuries diagnosed?
Sports injuries are the injuries which occur to a sports person. It can be either a professional sportsman or even an amateur sportsman, or even a common man who is taken to the sports field. It can happen during the sports, or it can happen even during the training period. So any injury which happens during sports is called sports injuries. Now there are different type of sports injuries. It can vary from, say, from a small minor cut, abrasions, what we call as small wounds, and from there it can range even up to major injuries like dislocation of the joint or the fractures of the joint. The usual injuries which we come across, especially in the younger population, are the ligament injuries, and ligament injuries can lead to instability of the joint. Usually the knee and the shoulder are the most common ones which are involved, but apart from that, the ankle sprains, the recurrent ankle sprains can also happen to the younger age group. Sports injuries nowadays are on the rise. It's become quite common, and we come across a lot of patients with injuries, sports injuries nowadays. But and especially with a lot of people taking to sports, like even the amateur sportsman, the occasional sportsman, who are usually a lot of these IT professionals who go and play on the weekends without much warm-up, without much training. They go and play, and suddenly they sprain their joints, and they can injure their joints. So those are the ones which affect the not the irregular sportsman. But as the level of competition is going higher and higher, as number of matches being played by sports persons are increasing, the sports injuries are also on the rise. And in fact, one of the major reasons is lack of proper physical training. I always tell, And it has to be individualized training. It has to be an individualized training. You cannot give the same kind of physical training to a runner and same kind of physical training to a cricketer. Even in cricket also, the batsman and the bowler, they need different kind of physical training. Same comes the role of physiotherapist also, who keeps assessing these patients and players and making sure that they are injury free. Now, apart from the apart from physical training, the most important thing is to prevent injuries. Apart from the need of preventing injuries, that can prolong the even the playing years of the sportsman. Because nowadays, if a player say misses a season, he's going to lose millions of dollars, that kind of thing. So that's the amount of competition also nowadays which is there. So everybody wants to be fit, but again it's a high demand area. Regarding diagnosis, the sports injuries are usually they come to the casualty or the hospital, and then they are first treated by the casualty medical officer, and they are seen and they are sent for x-rays. If good history and physical examination is very important while treating the sports injuries. And usually most of the injuries, if it is fractures or anything, can be diagnosed by x-rays, but the more the complicated ones, that means the ones which have ligament injuries or the injuries to the meniscus, which is the structure in the knee joint, or same way the shoulder injuries, they are usually diagnosed by either ultrasound or MRI scanning. Now, but the first person to see these injuries is the physiotherapist who is on the field. The physiotherapist should be able to assess the patient properly and make sure it's a minor injury or a major injury, and whether the patient or the player needs to be shifted to the hospital. Even shifting to the hospital is also very, very important when such an injury happens, that make sure that no further injury happens to the player. So whenever an injury happens, that area has to be protected well.
So doctor, what are the treatments for the sports injuries?
Now the treatment depends on the type of injury. If it's a simple sprain, say grade 1 sprain or grade 2 sprain, they can be treated by rest, ice packs. The injured part should be kept elevated, and at the same time it should be, sometimes it has to be protected with a splint or a plaster. But before that, I always tell, the most important thing is on the sports field, not to aggravate the injury, the injury should not become worse. So the most important thing is, so a lot of times we come across that the player says that, or even the students in the school, they say that I sprained my ankle and somebody tried to rub it out, massage it. And I think that should not be done. So no massage to the injured area, no heat therapy, and no application of any ointment. These three things have to be important: no massage, no heat therapy, and no application of any rubbing of that area. That area should be, the injured area, if it is an ankle or a knee, it has to be protected, or preferably it should be protected with a bandage, and some ice packs have to be applied. The cold compresses, what we call. Once the patient comes to the hospital, these minor injuries can be treated again, like I said, with the plasters or splints. But the major ones, the major ligament injuries or the fractures, they need surgical treatment. Now, the fractures are usually treated by the trauma surgeon or the orthopedic surgeon, but the ligament injuries or the joint injuries, they have to be treated by a person who is trained only in treating sports injuries, and usually they are the people who are trained in doing arthroscopies. Arthroscopy means keyhole surgery of a joint. So the different type of injuries which happen, and apart from the arthroscopic surgery, the most important thing is the rehabilitation of the patient. That is the physiotherapy and the rehabilitation, and that is, I would say, constitutes almost rest of the 50% of the treatment. Physiotherapy, again, so the rehabilitation of the patient can range from 6 weeks to 3 months, and sometimes after a major surgery, it takes up to 6 months for the patient to come back to the sports field.
So doctor, can you tell me the Indian scenario regarding the sports injury treatment?
See, earlier, a few years back, we used to hire a lot of Western physiotherapists, like people from Australia and South Africa. They are supposed to be the good physiotherapists and good physical trainers. But nowadays, the standard of Indian physiotherapists has really gone up, and we see a lot of good centers coming up in India who are actually specializing in treating sports injuries. And same with the orthopedic surgeons also. A lot of orthopedic surgeons are getting trained, specialized, and specializing in sports injury treatment. In Kerala itself, there are so many centers who are doing sports injury treatment. But apart from that, apart from the major cities, not much is happening in the smaller towns, and I think that is where now the authorities can do a lot. In fact, they can set up training facilities, set up rehab centers where the players, the sportsmen from the smaller towns, they can actually be diagnosed early with sports injuries, and then even a lot of time what happens is a player who is a budding player, he has some minor injury and he hides the injury because, or sometimes he is not given proper advice, and slowly over a period of time the injury aggravates, and once the injury becomes such a stage when he is unable to play, at that time sometimes it may even end his sporting career. So I think diagnosing a sports injury is very, very important, and even spreading that facility throughout the country, I think that is very, very important. To conclude, I would say regarding sports injuries, diagnosing a sports injury is a very, very important thing. Early diagnosis leads to better results. Second, immediate treatment at the even on the field treatment, or as soon as the patient reaches the hospital, giving proper rest to the part, ice packs, avoiding heat therapy, avoiding any major jerks to that injury, to the injured part, and then getting the specialist to see the patient and give proper treatment. I think these are all things which are very, very important while dealing with sports injuries.
Thank you, doctor. Thank you for your valuable time. You can email your queries and suggestions at youthdiary@rosebowl@gmail.com. Thank you.